Welcome to Conversations Live. For more than a decade, we've brought you the best in books, entertainment, celebrity interviews, and current events. When the movers and shakers of the world have something to say to you, they say it to us first. Now celebrating 17 years of broadcasting success, here's your host, Cyrus Webb.
Hello, everyone, and welcome back to Conversations Live. I'm your host, Cyrus Webb. Glad you all could join us once again, both for our radio audience here in Mississippi at WYAD 94.1 FM and WYADonline.com. We're glad that you all could be with us. Also, those tuning in through online affiliates around the world, thanks to iHeartRadio and Amazon Music Podcasts. We're glad you all could join us as well. This is part of our News You Can Use segment, and we're talking about the blood cancer multiple myeloma. Unfortunately, even despite the advances in treatment, it continues to be an incurable disease that can be categorized by periods of remission and relapse. Now, patients with relapse or refractory multiple myeloma may have some situations in their lives where they have a very low response rate to the treatment that they are being given. Well, thankfully, there is some hope on the horizon thanks to what has recently been approved by the U.S. Food and Drug Administration. Here to talk to us more about this, we're excited to welcome Dr. Nina Shah to our program. Also, we have Cecilia Romanski, who's a patient previously diagnosed with multiple myeloma, to talk to us about her experience. Thanks to the two of you for the time. Really appreciate it.
Thanks for having us.
Dr. Shah, I'll start with you. We've talked on this program before about multiple myeloma and those who are impacted by it, but what exactly is relapse or refractory multiple myeloma?
Yeah, relapse refractory multiple myeloma is a cancer of the blood cells or the immune cells, and it is incurable. And patients tend to have, as you mentioned, periods of time where they have their cancer controlled and then their cancer is not controlled. So this is truly an unmet need to have a new therapy for multiple myeloma. And I should say that actually I am a myeloma specialist, but I'm not being paid by Bristol Myers Squibb to do this interview. I really just want to raise awareness about multiple myeloma and this new treatment option available, Abecma.
Thank you for that, Dr. Shah. I appreciate it. Cecilia, I want to go to you. I mentioned in my introduction that you were diagnosed with multiple myeloma. For yourself, what are some of the challenges for people living with relapse or refractory multiple myeloma?
Hi, yeah, thanks for having me. I was 40 when I was diagnosed with multiple myeloma. It was 2005. So, yeah, I think the biggest challenge, aside from like emotionally just wanting to live your life, and yet because you are in a marathon of treatments, you're always thinking about what's the next treatment, what's next on the horizon. So to have this CAR T-cell treatment available is amazing. So it was just so exciting to get. It's a one-time infusion. So that was just tremendous because, like I said, you're just years and years of multiple different kinds of treatment and always thinking what's next. It's overwhelming, all the information that you can wander around in. So just having a resource of sticking with your doctor, and Abecma.com is an amazing resource. It answers your questions for your family, friends. It's very user-friendly. It's very informative. I love that site.
I appreciate you sharing this, Cecilia. We're going to remind our audience of that at the end of our segment for sure. Dr. Shah, I was really fascinated when I was doing the prep for this conversation because, again, we have talked in this program about multiple myeloma before, but talk to us a little bit about how common is it? I mean, it's something, as we mentioned, that is, at this point, incurable, but how common is this particular blood cancer?
Yeah, it's actually not uncommon. It's the second most common adult blood cancer in the United States. So wow. It actually is pretty common to meet people with multiple myeloma. And as I said, I only take care of patients with multiple myeloma, but it's pretty common actually.
And Cecilia just mentioned, of course, the great news about what's been now, it's seen as help for those who are dealing with multiple myeloma. Can you talk to us more about the new treatment options that are available?
Yeah, so this treatment option, Abecma, is a first-in-class CAR T-cell therapy, which is a way for T-cells, your own T-cells, to be engineered to attack the myeloma specifically. And so it's really a first-in-class new option for people who want to treat patients with multiple myeloma. I do want to mention that the T-cell therapy does have some side effects that can be serious, including something called cytokine release syndrome, also known as CRS, as well as neurotoxicity. And, of course, if any of these side effects happen, you need to talk to your doctor immediately. But this is something really new that uses immunotherapy and your own immune system to kill the myeloma. So we're so excited to have a new option for these patients.
Did you find, Dr. Shah, as we were dealing with this past year during the pandemic, that more patients were not able to or weren't following up with their doctor during that time? I mean, did you see a decrease during that time?
Yeah, I think what was interesting about the pandemic is that people were less wanting to go to voluntary appointments in person. So a lot of the things like mammograms and blood tests and things that were sort of routine kind of fell off the wayside. But one thing we did learn to use better was Zoom or telehealth. So I did end up seeing a lot of my patients through the telehealth platform, and I hope we can continue to keep in touch with patients and maintain access through that platform.
I think you're right, and I think it's such a great thing. My mother has been able to benefit from both. She's had some in-person in the past year, but also telehealth as well. A great way to stay communicated. But I think the important thing here, and I'm so glad the two of you are talking with us, are about this new treatment option, because as Cecilia mentioned, it's something that is definitely going to be beneficial. And again, for those who are dealing with multiple myeloma, any help that they can get, they can be able to benefit them is definitely something that we appreciate. Again, everyone, Dr. Nina Shah as well as Cecilia Romanski have been our guests. Cecilia, you mentioned it earlier, but do you mind sharing again where our audience can go to get more information about the resources available?
Sure, yeah. Always ask your doctor, too, about treatments. But abecma.com, ABECMA.com, is a great website for family, yourself.
We'll definitely want to make our audience aware of that. We'll be posting it also for those joining us via the podcast. Thanks to the two of you for the time. I really appreciate it. And it goes without saying that both of you are welcome back here anytime.
Thanks so much. Thank you.
Hey, the pleasure is definitely all ours. You're welcome. And we thank your audience for tuning in to another great segment of Conversations Live. Until next time, I'm your host, Cyrus Webb, saying as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Live. Now let's go make today amazing. Take care.